Hey, what's up, everybody? Welcome back to Basically EMS. Today we have a fun special episode. We're going to be doing an episode talking about some experiences for LGBTQ plus people in EMS. So a lot of new faces on here. If you guys want to go around, we'll start here and kind of introduce yourself and tell us who you are and what you do in EMS.
Absolutely. My name's Tim Kelly. I've been a paramedic in Texas for almost 8 years now. I just moved down to Boise in February. I've been active on a box. This last year was the first year I have not actively been on a box. I have been instructing in schools. And, I've absolutely loved my experience. I am gay. I have a husband. We both moved up here from Houston, Texas. And, there's a little bit about me.
Cool.
Sweet. How's it going, everybody? My name's Sid. I've been working in EMS for just a handful of years, just getting started. I'm an advanced EMT, I guess maybe I should say that as well. But I've been teaching CPR kind of in the lifeguarding realm for about 6-7 years and wanted to learn more and got into EMS and progressed from a basic up to an advanced. I would say I identify as a lesbian, but we'll get more into that as we continue to talk. So, but yeah, super stoked to be here.
Cool. Mama Kate.
I'm Mama Kate. I work at IMA. I employ a lot of EMS providers to teach AHA classes. And I'm here because I want to make sure I'm a good employer and I make sure I invite everyone to the table and everybody has a voice, especially my employees.
Also certified EMT. So let's not
Yes,
overlook
I am an
that.
EMT basic.
Yes. Hey, that certificate's in your office.
It
Don't look down
is,
to
it
yourself.
is.
You took the national. That's the hardest part.
Cool. So first, we kind of talked about this before we were starting, but LGBTQ plus, it's a lot to say, and I'm going to stumble over it. So coming from you guys, is there another way for us just to be on the same page as we're starting? Educate us a little bit, like terminology, what's okay to use? Is there something we can just say at this table that will make it a little easier for us all as we talk about it?
Yeah, absolutely. You want?
I'll let you start off
Okay.
and I'll follow.
Okay, sweet. So a lot of people in the LGBTQ plus community and allies use the word queer as well as like queer community, which I know for some older generations, not calling you guys old.
That's what I'm here for. I represent.
Queer was kind of like a taboo word for a long time, but I think that the gay community or the queer community has kind of reclaimed it. And as long as you're not using it in a derogatory way of calling somebody that and pointing a finger like, you kind of used to in elementary school and school, all the way up until senior of high school and college and what have you. Saying like, oh, the queer community or I have a friend that's in the queer community is not frowned upon by any means. I would say it's encouraged even. If you agree.
I do. I am one of the people I happily admit, like I'm in the queer community. I don't need you to tell me all the letters. I fully understand that the blanket is a very important thing. I love my entire community of my queer peoples. So,
and some people don't feel like they're called to a specific letter. Like my partner feels like she doesn't really have a specific small community within the queer community that fits her best. So she just calls herself queer and that's what makes her happy. But like if she's happy, that's like how you identify, then perfect. So I feel like queer is perfect.
So intent's probably a lot of it, right? Like
yes.
the intention behind the word. So if I say, if we're talking about the queer community, even me as a straight dude, it's okay as long as it's not meant in a negative
Absolutely
connotation there.
I
right?
agree. And like I said, like me and Tim don't speak for everyone that's in the queer community, like not the Lorax, we don't speak for the trees kind of thing like we were talking about earlier, but that's how I feel. And as you'll learn as we continue to talk, my opinion is my opinion. Some people agree and they don't. But
so how could Kate and I, we're meeting somebody that we know they're out, whatever. Is it just like, hey, is it cool if we talk about the queer community, or how do we ask that question in a way that's, that's not patronizing, or that's I'm trying to think of how to put it, like a sensitive way to ask, what words can I use?
Well, I will also say communication when it comes to like body language, facial expressions, as long as we know it's not like you are trying to crap on us or you're like, oh, we're being welcoming, not patronizing. Like, I'm trying to kind of be on a respectful level with you. You can approach me like, you're part of the queer community. Tell me a little about that. I have no issues. Like, oh, yeah, absolutely. I'll tell you a little about myself. It lets us know we're welcomed here. We are in a safe spot. I grew up in Texas. There's a couple places that is not a quote unquote safe spot for me to be around now, but knowing people, I can see fairly quickly, like you were talking about earlier, I can tell very quickly if someone is patronizing me and I'm like, I have red flags going up.
Right.
But communication is a very big aspect of body language, facial expressions, and just kind of being open-minded to talk to us about this kind of thing, you know?
I totally agree. Like you can talk to somebody, and I mean, with any topic, whether it be the queer community or anything that is a soft spot for yourself, you can tell when someone's making fun of you because you're part of the queer community, or maybe your mom passed and it's like people think it's funny to poke jokes. You can tell when someone's making fun of you for something that's sensitive in your life. Equally, you can tell when someone's genuine and like, hey, I don't really totally know what it means to be non-binary. Can we talk about that if you have knowledge? Because just because someone's in the queer community, doesn't mean that they know everything about every letter and every person and what they identify as. But the only way to find out is like, let's just have a conversation. I think that there's a lot of misconception, or it might be true depending on who you've interacted with, that it's like a trap door. If I ask you once and I screw it up, and now I feel like I'm labeled as maybe homophobic or transphobic or one of the phobics that we don't want to be, right? And I truly don't believe that that's how we get people to understand our perspective of anything, whether it be religion or the queer community or whatever it may be. So if you come at me with a, hey, I'm a little curious about XYZ, can we talk about it? I would love to talk about it.
Is that true with pronouns as well? Because sometimes I'm not sure what someone's pronouns are, but I also don't want to be offensive in any way. But growing up, my generation, you were very much in a certain pronoun, and now it's not quite that way. It's a lot more fluid.
Right.
Is it appropriate right when I first meet someone to ask them their pronouns? It's not going to be offensive in any way.
Always approach these conversations with an open mind.
Right.
If you are very closed-minded, you may not like the answer. So that is something you have to understand. There's a lot of walls that are built around our society, and it's very much, I don't understand everything, but I understand that every person has their own dynamics and how they work within my community. So anytime I want to approach these questions, open-minded. I want to know, tell me about it. So it's very much, as long as you can approach it appropriately, yeah, absolutely ask about pronouns.
So is there anything that makes it inappropriate? I mean, I consider myself an open-minded person, but I want to make sure I don't offend in any way.
I think that asking someone, hey, I'm just wanting to make sure that we have a clear and open communicative workplace relationship, whatever it is. Do you mind if I ask you what your pronouns are? No. Not a bad way to go about it. Personally, I don't talk about it a lot at work, but I like to identify with they, them pronouns. Okay. Not a lot of people know that, especially in EMS, like we were kind of talking about here. It's a little taboo, and there's some people that are off-put and closed-minded. So if I feel like I walk up to them and I'm like, hey, I'm Sid, I'm new here, and I use they, them pronouns, it's like, whoa, dude, we just met. Like, I don't know what's going on. I like people to know that I'm a good provider, I'm a good educator, I'm a good partner, and I'm a good person before. I find it easier to get people to understand my perspective when they know me as a person, rather than like, hey, I'm new here, here's something I'm requiring you to do for me. So I'm more open to sharing my pronouns if someone just asks me. That weight is off my shoulder of being like, when is the right time to slide this in, and it's not awkward, and now I have to perceive if you're going to be receptive to it and all that stuff. If you ask me, I'm automatically assuming that you're asking because you want to know, not so that you can throw it in my face later. I think that people that are asking from an open space, and that's my opinion.
How about for patients?
Yeah.
Would you say kind of the same thing with patients? If it's you're looking at somebody and it's not very abundantly clear what we can expect their pronouns to be, is it kind of the same thing because that's such a shorter thing, right? Like, I've known you for a long time now. It's much easier for me to be like, hey, what are your pronouns or that kind of thing. So in the short term for a patient, as a responder who wants to be sensitive to these subjects, same thing. Just it sounds like really everything's like, if you have an open mind and you're being respectful, you're probably going to be pretty safe with your questions, right?
Absolutely. I think for patients, it's all about communication and coming from a place of like genuine understanding, like we were talking about. And sometimes if you even ask that question, even if it is what you perceive it to be, like someone looks like they're male and I ask them what their pronouns are and they say he, him, it's like, well, now I know that you're an ally in some way. Maybe I can open up more about what this emergency is about and why it's happening. Or, you go on a abdominal pain young woman patient and you automatically go down the ectopic pregnancy route, but she's like, I'm not comfortable to tell you that I'm sexually active. but not in a way that I would get pregnant, you know? And that's, so if you ask me what my pronouns are, I feel like I would kind of relax and take a breath and be like, yeah. And you know, like, oh, I use blah, blah, blah pronouns, whatever. And I am having abdominal pain. And I know we were talking about being sexually active and all that stuff, but I want to let you know there's no way I could be pregnant, right? Because of who I'm choosing as my sexual partners. Now we just became a better healthcare provider and knowing more about the picture. And we hear abdominal pain in young women, and we're trained pretty quickly to think ectopic pregnancy because it's so scary and deadly. But if you learn that from your patient, now it's like, oh, maybe I can actually figure out what it is instead of just being like, what's the thing that killed them the fastest? Oh, it's always ectopic pregnancy, right? Which is true with people that are exchanging in sexual relations that could get them pregnant. Not everyone is, you know? So I think just asking them that and maybe understanding your surroundings. Same idea when we go on calls for people that show signs of abuse. We want to separate them from the possible abuser. Same idea if we go on someone that is a young adult that we think could possibly be queer, but you kind of gather some information based off the home or where you're at the call, maybe separate them from their family that maybe isn't supportive or whatnot to really get to know your patient. Like we meet people on the worst days of their lives. They don't need someone also standing over their shoulder telling them you're not gay, whatever. Same idea with abusers, right? We want to...
Yeah, no different than a teenage girl is not going to tell you she's sexually active with mom and dad standing over the shoulder. Maybe they're not going to tell you that that they're a lesbian or whatever if mom and dad are standing over the shoulder.
Exactly.
It's not a safe environment for them to say those things.
Exactly. Same idea as, you know, any other cases of abuse, because that can be considered, you know,
for sure,
abuse. So just be yourself, and people can tell when you're putting up a front.
They can genuinely tell when you're being a genuinely good provider.
Yeah.
Like it is very painted like a quick picture where you're like, oh, wow, you actually are asking the right questions. Again, I know I say it a lot, body language, facial expressions.
Absolutely.
Read a lot. If you have kind of a judgy look, yes, I will personally, as a patient, I very rarely am a patient, immediately I have red flags going off as guard what you say, control what you say. This is probably not a great place to be telling a lot about you personally. It's one of those things as a provider. I've had multiple patients in my EMS career where I can ask very not out-of-pocket questions, but they're like, you're okay with this? I'm like, absolutely. Look at me. And they're like, oh, let me tell you so much more. I'm like, absolutely. Lay it on me. Let's
talk
go.
about it,
Like,
You can be a lot more open. And
absolutely.
Even if it's not helpful in the assessment, it's helpful having people more comfortable in the back of your ambulance. Whether it's they're giving you information to tell you what's going on, or they just feel like they're happy that you're the one that showed up on their worst day, you know?
Absolutely.
So
Absolutely.
kind of along that same vein, you guys as members of the queer community, like what has been your experience with patients and how they react to you, whether they can just pick it up or, I mean, good and bad, right?
Yeah.
I'd imagine that
we're both giggling just because
there's good and bad. And for, you know, maybe somebody who is watching or listening to this who hasn't started working, who is struggling with this, what are some things you've done that you think can maybe been able to disarm those patients? Because we get it. We go on a lot of old people where it's just not like, you know, me and Mama Kate, we're cool and young and accepting. And that's not always
Cool
the case
hip.
for a 70, 80-year-old that grew up in Texas, right? It's going to be a different thing. So what's your experience been? And do you have any kind of input for other people in your position of like, hey, here's what I've done that's been helped me be really successful with those patients?
Yeah.
You want to go first? You or me?
Go for it.
So a lot of my patients, specifically old grandmas, my goodness, when they see me, they are drawn more to me than my big old firefighters. I don't know. It's just I'm very much a bubbly, smaller dude. I am very small, but I'm tall. In the nicest way, they love seeing my personality come forward. They look at me like, oh, wow, you care about me. And I'm like, that's who I'm here for, Mama. I want you to be taken care of. I want you to have the best care I can give you. I'm going to be your advocate. They can see it a mile away. That has been the majority of my experiences. And I can see other people who have a much more, I'm here in only a professional manner. I only do X, Y, and Z. I'm a very light, bubbly person. My personality shines forward as who I am to kind of let my patients know I'm here for you, you know? That's really one of the big ones for me is I don't look like your average paramedic, apparently.
Right.
In the nicest way, apparently. I'm a very easygoing, light, bubbly person. That's not a very big personality in EMS.
Have you had any patients that initially it seemed like there were some guards up and, like this, like, whatever and then as you kind of just continue to be yourself, that comes down a little bit? Do you feel like that helps them to be more open?
I've had young female patients become very uncomfortable. They look at me and they're like, "You're a guy." And I go, "Okay." I start talking, simply asking them questions. They will open up so nicely and they're like, "Oh," and I'm like, "Understand, I'm not a threat. I am here to take care of you. I want your needs to be met, whether it's mentally, physically, you need to go to a hospital. I'm going to be that bridge that connects, and my personality kind of pushes that forward. And I will have patients absolutely open up, telling me really personal stuff in their life that's been going on, suicidal ideation. And I'm like, I get it. It's rough. It's very hard. But I just push forward that, like, I'm here for you. What can I do for you? And that is, I don't know, my best take is being the best provider I can be. And they see that often come forward.
I feel like, though, we don't want to deter people that are not part of the queer community that you can't be that person.
Yeah.
Just because you're a straight white dude that has a mustache, like we were talking about earlier, doesn't
very
mean
handsome straight that way.
Yes, with wonderful tattoos and is so kind. Yes, doesn't mean that you can't make this teenage girl that has a more female emergency going on. Just doesn't mean that you can't make her feel comfortable. Sometimes there's a certain line that just cannot be bridged, like a bridge cannot be built because young girls are closed off, especially if it's like a handsome firefighter that's come in to help her out. You know what I mean?
Thank you.
Right, thank you. But you don't need to be a more openly bubbly gay man to make this young girl feel comfortable.
Absolutely.
We can always take strides to kind of bridge that gap. And with every patient, the way that you're going to speak to that 16-year-old girl that's maybe having suicidal ideation is going to be different than 70-year-old Peepaw that's having crushing chest pain, but he doesn't need to go to no dang hospital. Like I like to call it code switching,
Absolutely.
So
I 100%
I do it
agree.
in my personal life and I do it at work as well. So, yeah.
So do you have your experience? Has there been any like very obvious, like, I don't want to talk to this person because of who they are and anything like that? Have you experienced that, and how have you kind of navigated those things?
Yeah, that's something that kind of led to some serious burnout for me at my last agency. It was a little bit more rural in Idaho, right? Typically, the rural cities in Idaho have some older communities, which are not as educated in the queer community, and just how different people can look different ways, and doesn't mean that they're a bad or a good person. There was when I was a third and when I was in training out at that old agency, I was with an all-female crew, so a female medic, a female advanced EMT, and myself, who was an advanced EMT, but I was riding as the third. We would often go on calls together. I was the only queer one, but they were both women as well, where they would be like, "Oh, they sent the girls. They can't help me, whatever." And then I like I said, I led to some burnout when we would go on calls that came out as pretty high acuity, like chief complaints that are scary of crushing chest pain or whatever it may be, difficulty breathing, immediate life threats. And suddenly all those life threats are away when I'm the one sitting next to them in the back of the truck, and they feel like it's a comfortable place to share their negative opinion on the queer community. I'm like, I thought you were having crushing chest pain. Like, what? So we are masters of kind of getting people to get back on track, whether it be about their political or societal opinions, or you try to ask A&O questions and they are off on a tangent about why'd we call today. And, so you have to kind of have some thick skin sometimes, because I am here to do a job, right? Like I'm a person when I'm not wearing my tactical pants and my boots and I'm not at the ambulance, but here I'm putting myself out there. I know that's the job I signed up for, to help people on their worst day. You need to get good at kind of dodging some questions and comments and redirecting. And that's when you make sure you have a good community to support you, and that's who you talk to about it after. Right now, we need to get this job done for this person that's having crushing chest pain. And that's how it is with all things in EMS, right? Like if you go on tough calls, whether it's because they don't like you as a person or it's just hard to see, you got to kind of push it down for now and then talk to your community about it later. There's a job to get done.
So, okay, do you have a question?
Do you ever have issues with your partner? Because you're going to be on a 24 or 48-hour shift with someone. And it's one thing to have a patient that you're in the back of my ambulance for 20 minutes, whatever, I can deal with that.
Right.
But like, what if you're on shift with a partner who maybe has different beliefs? I mean, the rural community in Idaho can do that.
Yeah, I've had a lot of experience with that. I don't know if it was just the agencies I was at or I flipped a coin that didn't like me. I've had a lot of experience with that. In EMS, a lot of people love to use the R word. I don't like to say it. It makes me uncomfortable. To describe each other and talk to each other and stop being in whatever. And same thing with the F slur that people use to describe queer people. They say the same thing as stop acting like a blankety blank. I had a partner one time that thought it would be funny to call me that, and I was not a fan of that. There was a younger, more immature young man that worked at our agency that was a gay man that told people it was okay for them to call him that. And I think it was a more I'll make fun of myself before you can make fun of me self-deprecating thing, because he was more young and immature, and I think he kind of just struggled with finding the right place for himself and maybe some confidence, and that's okay. That happens. But people thought because they could call this young man that, they saw Sid, who was also part of the queer community, and Sid would be okay with that. Sid's not okay with that. And you guys know me. I'm not afraid to be outspoken, and while still remaining professional, I told him to never call me that again, and he would regret it heavily personally and professionally if I ever hear that word coming out of his mouth towards me again. And he was very much understanding, but from then on, he didn't like me because I called him out on it. But you're not going to call me a slur, especially not at work.
Well, we shouldn't be calling anybody a slur anywhere at work.
Right. But I still had 23 hours left on shift of that guy, right? And your partner needs to be the person that has your back the most, right? When the scene becomes unsafe and you don't see it, that your partner does, I want to know that this guy is going to tell me and have my back and tell me things that he doesn't see. So, there's always a lot of times policies in place at agencies where if someone makes you truly uncomfortable, and there is, without demeaning it, an HR complaint that you oftentimes can be like, hey, I don't really want to work with X, Y, and Z. They did this to make me a little bit uncomfortable, and I don't feel like we would make a good partnership. I am not a person that will give up right away. I like to find some common ground, and maybe that happened in the past, and we can fix it and continue to move on together. But sometimes it's hard to find that common ground. You've so quickly just showed me all your skeletons in the closet about what you think about these people in this community, and it's kind of hard sometimes to pick that back up. And to be honest, we never did, and that's okay. He can go on and live his life the other direction, and I'll live my life this way. And oftentimes people that share those opinions that are like that also have some opinions about other groups of people that are also negative. The typical I hate my wife trope. I'm not a big fan of coming to work and talking about how much you hate your wife and that kind of stuff. So whether it be about gay people or women or people of color, I don't really want to hear any of it on this ambulance.
Right.
Whether I fall into one of those communities or not. We're here to help people. That's kind of why we got into this. So.
Literally what we signed up for.
Yeah.
Right.
You don't get to pick and choose who calls 911.
Exactly.
You need to help them with your education that you've accrued. But anyways, I digress about that young man who was older than me. But I think confidence is a lot of it, of knowing who you are and knowing that you deserve to have a space at this agency. You earned the job just like they did. You got through their hiring process, whatever it may be. You passed your national registry. You went to school. I deserve a spot here just as much as so-and-so does. Whether they're a straight white guy or a straight black person, queer person, whatever it is, we all deserve our spot because we earned it. EMS is not a draw of a hat kind of thing. You earn your spot. Mm-hmm. You earn your keep.
I agree.
So kind of similar thing, right? Kind of on the partner line. What's kind of, I guess expectation is not the right word, but if me as your partner, and we're on a call and somebody calls you a slur or something like that, like what for you guys, and this again, you don't speak for everybody, but what would your guys' line be? Because especially when I was FTOing, they just love to stick like kind of less confident women with me. And that was kind of, I feel like my role was to help build that confidence. And, and there's times where I've had to step in because there's belligerent men, like with my female partners or similar situation, somebody's a slur, like would it be stepping on your toes for me to be like, hey, that's not cool. You can't talk to my partner like that. Is it something just talk about beforehand, or like what's your guys' take on how can I be a good partner in those situations to you out on an ambulance or a fire engine or whatever?
Yeah.
Well, I mean, one thing that's specific when it comes to partners, I still have some of my closest friends to this day are my old partners. The ones that I truly stuck with and I knew they had my back, honestly, we never even had to discuss it because we just kind of had a feeling about it. It was, they knew who I was as a person. I knew who they were as a person. And we just intertwined and we supported each other one way or another and made sure. Now, when it comes to like, oh, they called an F slur, my question would be more like, was this a psych patient? Because I've had those lovely psych patients who I don't think they even looked at me before they started saying these words. So I'm like, are you just half out of it and we need to get you to a hospital regardless?
Right.
Or is this someone who looks at me up and down and goes, oh, and I can see hate boiling out of them. And I go, okay, this isn't a safe spot. I would like to know my partner has my back, specifically in that kind of situation. Again, I come from Texas. I'll give you a little bit of fun story from my hometown. I'm from Cut and Shoot, Texas, spelled as it sounds, C-U-T and shoot. Yes, that is my hometown. I was born and raised. So I've met all kinds of fun communities, but knowing my partner has my back is very important. It is one of those things. Not always is there needing to be a discussion. My partners know me. I know them. If someone comes after one of my good partners, I'm going to buck up really hard no matter what is going on. We have each other's backs. And that's kind of the important aspect for me.
Yeah, I mean, we want to have all of our partners back no matter who they are and what they identify as, right? I think oftentimes it usually comes from, in my experience, elderly men, which is a general statement. It doesn't mean that it's everybody, but I've found that a lot of older men step to and kind of press feminine people because they don't see masculine people as like someone that they're willing to pick on. So oftentimes men don't do that to me because they see me as masculine and they know I'll kind of go toe-to-toe with them respectfully. Don't call me that. Did we call 911? Yes or no? Sign here. We're going to head out if you don't need us. You know? So even times when I'm paired with another woman who's just, you know, female, feminine girl, I worked often at one of my old agencies with a lot of female paramedics, and they would try to poke holes in, you know, our partnership because we're not two big guys with mustaches that can't touch our shoulders because we're so buff, you know? But oftentimes the minute that I told them to be respectful or whatever it may be, they listened because I do have a more masculine persona about myself. So even if we were on a truck together, like we could say that you're a little bit more feminine than I am, and it's kind of roles reversed a little. Like maybe they would poke more holes in his understanding and his capabilities than they would mine because I'm more masculine, right? So just because someone is a man or a woman doesn't mean that they'll get poked at. It's like the energy that you put off, and people that think that there's someone that's smaller or less confident in who they are, that's usually who they pick on, right? They don't pick on the battalion chief that looks like they've seen some stuff and they've been there for a long time and they come in with confidence. They pick the 17-year-old EMT that just finished EMT school and looks like they're scared, right? Yeah. So it's all about having your partner's backs no matter their identity, you know. I had a partner who is a good friend of mine who, when I got out of the back of the truck, it was an ALS call and he was a paramedic, so I went to go drive, you know, typical. And the patient was like, "Are you sure you're comfortable with a woman driving this thing, you know, whatever?" And the paramedic looks at him and goes, "Yeah, she actually gets awards every month for being the best driver at our company." He's totally kidding, but he's like, shut up. And this guy it was an IFT call, so it wasn't anything too crazy, but he was having an NSTEMI. His troponin was high, and he needed to go from the small hospital to downtown Boise, right, to get the higher level of care. And he's like, "Do you want a helicopter? Because that's going to be more expensive." Like, because that's like, I don't know. I really appreciated him in that moment. He told me later, he's like, "Dude, you know what he said to me?" And I'm like, "No, what?" And we just like giggled all on our way to the gas station about it because we're friends, and I knew that he had my back. So
cool. Yeah. So yeah, the like, you know, don't be patronizing, but have each other's backs for sure. Totally. And you know, yeah, I that goes for everybody for sure. But I just wanted to make sure there's no extra sensitivity because of maybe some history you guys have had of people that like, because I'll scrap for sure for my partners.
Yeah.
And like I've many times gotten up in people's faces because I am the scary dude with a mustache,
Yeah,
the bald dude with a
exactly.
mustache, right? And so, yeah, you know, if you're listening to this, watching this, like, I just want to make sure, you know, we're being sensitive to you guys and not treating you any different, that like you're more fragile, right?
Yeah.
Like, because I feel like that could probably be a thing, and maybe I would expect it. Maybe you guys have experienced it, but I, you know, definitely want to make sure that's not.
But just
happening.
know we greatly appreciate. Like,
Yeah.
for example, this is coming from me, small. I am 130 pounds soaking wet.
Yeah, I was in like sixth
I-
grade.
I was going to say, I remember fifth grade.
I could not take on a full-grown firefighter if you asked me to, like, in the nicest way. My partners that I'm still fairly close with are some big old dudes who are like, ooh, you screw with him, you screw with me. And I'm
Totally.
like, he's got my back. I am a more female or a feminine presenting kind of guy.
Yeah.
I'm not ashamed of who I am. I love my personality. I would not want to change myself.
Totally.
Did this something take time to be able to kind of acclimate myself to? Yes. But I'm much happier as a provider, as forward presenting to my patients.
Totally.
I do not regret who I am as a person. It's nice to know that I have people who will stand up, buck people when they need to. I'm not needing you to go fight patients for me,
Right.
but understanding that the support is absolutely heard and seen, and it's amazing to have note of that support.
I mean, I feel like just like any partner, give them an opportunity to stand up for themselves. And if it
Yeah,
doesn't
yeah,
go the
yeah.
way that it needs to, I'll take care of it any day of the week, you know? And I think the people that are more likely to not stand up for themselves know when they're surrounded by people that will stand up for them. And it's just about being a good coworker and family member, you know, when we're spending 24 hours a day together.
We live together.
Yeah, exactly.
Unfortunately, at that point, we are not just, you know, oh, we're working. We are living together.
Yeah.
I have lived with a woman for, gosh, many years now. Shout out to Nicole Bowker in Texas. She's one who taught with me. We lived together in an apartment for 3 days at a time. And that was, you know,
That was your life.
that was our life.
Yeah.
We enjoyed our job. We enjoyed our box. We are great partners because of it. But we, you know, work together like that.
So I know you guys at this point in your lives. How did you become so confident in this field that doesn't necessarily welcome you with open arms?
Yeah.
How do you get good at anything? Practice.
Right.
Unfortunately, I've had my bad days. Everyone has their bad days where you feel like the world has just beat you to a pulp. But you need to be able to decompress, mentally take care of yourself. I was very passionate talking about mental health and EMS. It will destroy you if you do not know how to cope with everything. We see dead people, we see people dying, we see the sickest people, the people at the lowest of their days, versus people who are just angry and the system has screwed them over to the point that they're now calling 911 and their life is in shambles. They take it out on us. Well, how do we handle this? You have to be able to mentally cope with this kind of stuff. Otherwise, you dissolve and you are good to no one, including yourself.
So what advice do you give to your 20-year-old EMT that's in a similar position you once were?
Don't be afraid of taking breaks. Talk to your loved ones. Talk to a therapist. Do not be ashamed of going to therapy, because therapy, there was a big taboo for a bit. We're like, oh, therapy means you're like mentally just
Soft.
icky. And it's like,
Yeah.
no, this is something you have to take care of yourself. I watched so many good paramedics become bitter shells of who they once were because EMS has just beaten them and they just didn't take care of themselves to that point. I would absolutely tell myself at 20 years old, don't be ashamed to be who you are. Go to therapy if it's something you feel the need to. And even if you don't feel the need, therapy is going to benefit you. And
Personal and professional life.
absolutely. Get a hobby. I am an avid gardener. Oh my goodness. I have an ungodly amount of plants in my house. I love what I do. It's something I have to be able to enjoy what I do to be able to work in such stressful situations constantly. And knowing we're going to be dealing with these stressful situations potentially on a daily basis.
Have a good community that uplifts you when you're down. It doesn't need, when I say good community, it doesn't need to be fellow queer people. It could be people that tell you, no, Sid, no, Tim, no, whoever, you are good at this job. I look up to you, whatever it may be. You being queer is just part of who you are. Doesn't need to be who you are as a provider, right? Like, my sexuality doesn't determine the fact that I can have a spectacular bedside manner and I know how to run a stroke call top to bottom or whatever it is, right? and having a community around you that uplifts you. I don't want to say despite your sexuality, because your sexuality doesn't determine whether or not you get to have a spot here.
Right.
But that loves you for who you are, full picture, not just who you are as a provider, right? Like I have plenty of friends and people in this community, people that I've met teaching, that I've met on the truck, whatever it may be in class, that say some of the kindest things to me about who I am as a provider, and it gives me confidence. When you hear other good providers that you look up to tell you that you're a good provider, it gives you all the butterflies, right? You're like, what? You're a paramedic that I love. I'm a good advance. I started you a good line. Thanks. Like, like it makes me feel good, right? And just having that community around you that uplifts you. And it doesn't always have to be people that look exactly like you or act exactly like you. I think having a diverse community is one of the most beautiful things about EMS, if we can kind of build that up,
And that for sure crosses all boundaries too, what you're saying of like getting that support, like especially new people, whatever, right? Like we've all been there, right? When you're new in this, and to hear, like you said, the 30-year, normally super crusty medic be like, hey, that was really good, right? Or I remember being in FTOs, and I had an FTO, and after I was like, oh, anything, I could have done differently, whatever. And we talked, and then the next call was his call. And afterwards he's like, you see anything that I could have done better there? And I was like, oh, wow.
Huh?
Like,
Yeah.
I felt like, cool. He respects my opinion and me as a provider. And, you don't need to be any sort of specific person to give that to your partners, for sure.
Totally.
Especially the new people, or the people, need that confidence build.
Totally.
There's an absolute point of building someone up, helping give pointers of how you can be a better provider versus I'm going to shred everything you did and nitpick everything you did to make sure you're self-conscious about every single step you take in the providing world. There's a very big difference. I've seen old-fashioned paramedics who will happily rip up a student one side and down the other and go, all right, now be a better provider. And it's like, you've done nothing for them.
I'm going to go cry in the bathroom first, actually.
I've had multiple times where I wanted to go to the bathroom and just cry because I'm like, what? And then I go talk to other people like, oh, he's just
like that.
a grumpy old man. And I'm like, he rips people up and down. Why would you want to be around that? It's one of the aspects of why I wanted to become an instructor. I don't ever want a student to feel that way. I'm here to build you up. Never am I to tear you down. Yes, I will give you corrections on how we can better our patient care, but I'm not here to strip you down and just shred you through the shredder. It's not going to help anyone. It's going to make a worse provider in the field.
And I think even for queer people, if you want to get into education, whatever it may be, don't be afraid to do it because you're queer. That is absolutely the last thing that I want people to do. I went through school here and around here and whatnot, and I had a spectacular mentor. We might know him, Wade, who normally sits here at this desk, and he's a great guy, and he taught me a lot of things, but it would be cool to see someone that looks like me instructing, and it kind of welcomes more people into our community. If you see someone that's like you teaching you, it makes you feel like you have a spot. So I think seeing more people get it that are in the queer community get into the leadership and into the instruction kind of opens new doors. I've noticed that, the school that I'm teaching at, that I've seen more queer people come through the school, and not to build my own self up, but I'm happy that they see someone that is like them, air quotes, for those of you that are listening and not watching, air quotes, like them. I hope that it gives them the confidence that they were maybe scared to come to in-person class. When I did my in-person EMT class, I was the only non-man in my class. Everyone else was men. And on the first day of class, Wade went around every person, why are you taking your EMT? You'll never guess what everybody said. Fire. Yeah. And I was like, I think I want to be an EMS. And maybe that day Wade saw the one non-fire person, and we got along from that because
Wade does love that.
He does love that. And we got along well, and now I consider us friends and coworkers and whatnot. But to have someone that looks like you, air quotes, is always helpful, whether it's you're queer or you're a person of color, right? We live in a state where it's predominantly white. So seeing someone that makes you feel seen and feel welcomed is always welcomed and encouraged, right? So I think that's also a great reason to get into it and
Absolutely.
Make your trainees, your students, your whatever new hires know that they're welcome here no matter what their background is, whether they choose to share it or not. People don't have to openly stand on the desk and say, I'm queer and I'm here to happy to be here. They don't have to do that to be just as queer as I am sitting in this podcast talking to whoever is watching. You know, you're queer whether you're loud about it or you just decide to keep that to yourself. That's your decision.
Yeah, and that's one thing that tends to be kind of nice about EMS is like, yeah, there's no handouts. Like you got to do the education the same as everybody else. You need to do the testing the same as everybody else.
We all went through national registry and hated it together.
Yeah, and like locally here too, to get on with the local 911 agencies is very, very competitive. Like if you're in that room in the interviews and everything, like you need to take some confidence in like, I deserve to be here, like you were talking about earlier, not because of who I am, but because of my skill set and because of my knowledge. I deserve to be in this room with everybody else, and hopefully everybody else on the other side. We're just, as somebody who I hire a lot of people because I run the EMS department at the school, and I don't care what you look like. Like, are you going to make my students feel good when they come in, regardless of your sexuality or your color or your gender, anything? I don't care. Like, are you going to give my students confidence and a good experience when they get here? Cool. Then you're exactly what we're looking for. I don't know, Kate, if
I definitely feel that.
Similar thing, because you do a lot of hiring for our AHA stuff.
I hire instructors that know their material and can communicate well. And that's what I'm looking for. But if I can get a diverse group of instructors, even better.
Cool. Yeah. I mean, but that's also you guys that are open and have open arms that are excited, I think Tim and I can probably agree on this in a different facet. When I walk in the door, for anyone that has two eyes that work, they're like, that person's gay, right? Like I got short hair and I'm a little bit more masculine and I wear boy clothes. Like, so sometimes when you are applying for a job for someone that isn't so open-minded, you're kind of at an uphill battle, like you're disadvantaged. One of the last agencies I worked at, one of their battalion chiefs would talk in the crew quarters openly about how much he disliked trans people. And I was like, I wonder what you thought of me when I was in my interview, and it's like, that doesn't feel good as a healthcare provider. We shouldn't be talking about politics or opinions on that kind of stuff at work because everyone's welcome in the back of my truck. When you talk about your politics, it's automatically assumed that you dislike the opposite side of the group and that you aren't going to give them fair care. That's not true at all. I don't care what you're wearing or how you present in the back of my truck. If you're scared enough to call 911 and need help enough to call 911, I need to be able to know that I'm going to knock on your door and be there and tell you that I can help you, no matter what political flag is in front of your house.
And those are the providers we want.
Right.
Like that's the provider I want at my door or my kid's door or my neighbor's door. I want a provider that accepts them and is willing to be a healer and a helper in any scenario.
And that's who we're trying to create with education, right? Like I tried to take a moment to kind of talk about that because I teach CPR for this department and I teach EMS stuff in this department. And I talk about that a lot when we talk about some of our heart code classes where we talk about how people of color or Latinx communities or women have a higher death rate when it comes to cardiac arrest versus men. And it's because they're not believed or whatnot. We need to believe everybody for what they're telling us and treat the symptoms the way that they're described. Not because I believe this guy more because of my biases, right? So we all have biases. We're all human, right? We live in a town that's very clean and nice, and it's hard not to clutch your pearls a little bit when you go to Portland and you see some people that maybe are a little scarier, right? It's our human nature, but we need to do our best to break that down and help people for no matter what they're saying. And that's kind of the students that we're trying to create. At least I know we are because we've taught together, and that's what we want to create, I guess, is the tangent that I'm going on.
Well, the one thing I always tell my students, I didn't mean to cut you off.
No, you're good.
The one thing I always tell my students is I want you to do the best for my community. What is my community? Everyone in this city, everyone on the outskirts of the city. If you go, I'm actually not going to be in Idaho, EMT, advanced in Texas, I'd have a lot of students being like, I'm actually moving to Oklahoma or some other state. I'm like, great. That's also my community. I want you to do the best for everyone in that community because that is my community. I want you to go and do the best you can for anyone encircling it. What is my community? Everywhere around this world. If you do it outside of the US, that is still my community. Even though I don't live there, every patient deserves to be heard, to have someone listen. Even if this is a simple panic attack, they deserve to have someone listen and be there. If it's not, they still deserve medical attention. But if that makes sense on the lines of everyone deserves to have the best provider, I only want the best for my community. those are the students that I try and push out.
Totally.
Like, you are the ones going out there. I want you to understand that they are first. First, foremost, put, like Sid said, all of your beliefs, do not care if they don't align with your patient. My community deserves the absolute best. I want you to go out there and provide that.
Yeah. And if you're hearing that and you're like, I don't know if I can do that, this is not the job for you.
Absolutely.
Go
I'll
somewhere
happily
else.
smile across my face, go, there's the door. Please leave.
Yeah.
Yeah.
This is not for you.
Yeah.
Yeah. We're going to have inherent biases for sure. And I feel like I've seen a lot of people, especially here in Idaho, that maybe come into EMS with some biases. And after, just like, especially when they're young, you know, like, you grew up around people just like you, that spoke like you, that talk like you, that think like you, that, you know, that vote like you, and all those things. And then you start to actually get some life experience, and you start to see other people. Like, you start to go on people that are homeless, or you start to see, you have a couple of patients who are queer. You see those people and you're like, wait a second, I was told they were scary. They're not. They're just people. And I've definitely seen a big shift in people over time, that they just start to hopefully become more open when they do this. But yeah, if you have those biases that you know for sure are always going to be there, I don't know, go do something else, right?
Something. God,
Don't work in
anything
healthcare.
else.
Yeah, don't work in healthcare.
It's very interesting, kind of what we're talking about, our biases. I'm here in a week moving to a city in Oregon, and I was showing my parents around because, you know, moving away, and they want to know that I'm in a place that I'm going to enjoy and that I'm going to be safe. And my parents are of the older generation, and sometimes there's some things that we don't quite understand, and we're going to talk about and whatnot. And I'm like, there are more homeless people there than there are here. Doesn't mean that it's unsafe, but I just want you to know that if you see that, that's has to be expected. And my mom and I were kind of talking about it a little bit, and she was asking me, like, well, why doesn't it scare you? She was genuinely curious. And I said, before I started working in EMS, sure, it can be scary because of your preconceived notions and whatnot, but you go on enough 911 calls for someone that is unhoused or just has had a not so lucky life as I have. Doesn't mean that they're a bad person. They just have different circumstances that they had to create a different mindset to get through. They're still humans with experiences that I would love to hear about because they're so unlike mine, you know? And I was talking to her a little bit about that, and I said, you know, EMS is not about what I'm going to do for the community. The community teaches me a lot as a first responder. As like I said, you don't get to pick whose 911 calls you respond to. And I learn so much from my patients every time I do a rig check, right? And I go out into the community, and we were kind of just talking about that. And she was like, oh, I didn't even realize that you could be learning things from the communities that you're responding to. It's not always you going there to be the person that's going to be in charge. You're learning stuff from them as well. And I think that's kind of something, if you're newer in EMS or looking to get into it, you're not always the one that's going to be in charge and know everything. You're going to learn stuff when you're out there too.
Yeah. Yeah. You better.
Yeah.
If you're not, like, and those are the best paramedics I've ever seen, are the ones that 30 years on, they've literally forgotten more than I've ever learned in their experience, are still like, what am I going to learn today, and how am I going to apply that? Right. Those are the best providers that are just lifelong learners, right?
Totally.
Like the people that I've respected, that has been their mentality, and it shows in how they react to things and how they treat their patients and all of that. Right. Yeah. And I can promise, and especially you having been a paramedic, you know exactly what I'm talking about. Most of us go through paramedic school and we're like, oh, I'm so smart now. And you like, you think that you're just a paragod, and then you get like
Paragods. Good golly.
you know, you get a year in and you're like, okay, I got this. And then something's going to slap you across the mouth real hard, and you're going to question everything about your knowledge. And then it's going to happen again a couple times, you know, like first 3 years of being a paramedic is so hard. 5 years on, maybe you start to understand how little you know, and that there's some solace in that, and you start to kind of figure it out. But you know, yeah, it definitely will slap you across the mouth real quick if you think you know everything. The universe will show you very quickly that's not the case.
Those are like some of my favorite stories here about paramedics that have a couple years under their belt. They're like, they tell you about the one call that's like,
You'll never see torsades, like you'll maybe, but, and then you get it 3 times in a row.
you're like the patient that has tardive dyskinesia but also has crushing chest pain, but you can't get a 12 lead because they're moving around and stuff, and it's like the thing that just slaps you across the face, and you talk about it later with your partner, the one that maybe has the lower level of licensure or less understanding of like what happened there, and the paragod that just got humbled goes, you know, like, I don't know. But anyways, you kind of just continue to learn. I tell our students that if every time you clock in, you don't learn something new, it's time to retire.
For sure.
And you need to definitely be at peace with knowing you're going to die a student. In the nicest way, that sounds dark and morbid. I will be learning till the day I die.
Totally.
Until I'm no longer able to comprehend stuff, every bit of information I get input into this brain, it's processed, and I'm like, oh, that's new. I didn't know that. But you've been here for 27 years. Yeah, I don't know what to tell you. That's just something I just learned today.
Yeah.
That's why I love healthcare, though.
Yeah.
Like, I love that I can always learn. And even as a teacher, I can learn from my students. Like, if
Totally.
I have the opportunity to teach someone who has background in this area, I can learn. But also you coming up with, like, the conversation you had with your mom, who's of an older generation, like we need to have those conversations and we need to make sure we're having more and more and helping our partners learn, helping our employers learn, helping our coworkers learn by having that conversation. I mean, I think that's why we're all at this table today. We need to have the conversation and we need to talk about it more openly and learn from one another.
And, kind of back onto the topic of queer people in EMS, I think that if you truly want people to see you and listen to you and understand your perspective, you need to come at it with less of a finger pointing perspective. It really bugs me when I see my fellow queer people saying, you need to respect my pronouns, you. It's like, it's human nature when someone comes at you aggressively to be defensive and not want to be understanding. So I truly try to kind of put my pride on the back burner and know that if I get misgendered or mispronounced, whatever you want to call it, at work, it's not always a negative thing that someone trying to spite me and hurt me. Maybe they've never met someone before that uses they, them pronouns. That's okay. I'm glad to be the first and maybe educate you if you have questions. I'm not always the one that's going to know everything just because I'm part of the queer community, right? But kind of coming at it from, hey, I don't quite understand, and maybe we can learn something from each other. Like, I've had plenty of partners that are very religious and I don't know a whole lot about that community. Let's learn about each other. It's not just everybody come to me and come learn about me and I know everything. That's not the truth at all. Tell me how your religion has taught you to love your neighbor, right? Like all that kind of stuff. And there's a lot more common ground there than people maybe understand if you don't come at it with a finger pointing. You need to do this. I don't want to do this. You're forcing me to do this, whatever. Let's just talk to each other like humans. If we get mad at each other, it's human nature to become defensive and not want to hear jack about what you have to say. And I think that's the best way to get everybody on each other's side, right?
Yeah, the social media world has definitely pushed that a lot, and there's not people just are in their echo chambers, right? And we need to break free from that, and crossing that, extending that olive branch of like, let me learn about you and you can learn about me. I'm sure it goes really far for people.
Yeah,
especially the older generation they're just old and confused isn't the right word. That's really not what I'm trying to get at.
Yeah.
But they just don't understand.
Different way of thinking.
Yeah. And so if they can see that you're trying to learn about them, I think they're just going to, and this is not about being queer. This is just in general, right? Like if they start to know that you want to learn about them, they're going to want to learn about you a lot more. And we can bridge those gaps just in general, for sure.
Even with patients, if you go on a call for let's say a trans person, what's the first thing we do when we call and report? Oh, here's my age and gender of my patient. Well, shoot, now I don't want to offend anybody, and I want to make sure logistically they get the correct health care. Like that's hard sometimes. So I think if you truly don't know what to do or how to do it, just talking to your patient, hey, when I call into the hospital, I need to give them your age and your gender. If it's okay with you, I need to tell them what your biological sex is, but I will gladly advocate for you that is not what you like to identify as, and you're in the process of transitioning to whatever it may be. I think that any trans person, I can promise you, is used to something like that. This is not the first time in their life where they need to say, yeah, I was born female, but I identify as male, or whatever it may be. They're used to advocating for themselves. I promise you that. That is not a new concept to them. I haven't gone on a whole lot of trans community 911 calls personally, but I think that's the way that I would go about it, right? EMS is healthcare and treating, but it's also patient advocacy. When we show up at that hospital, I'm going to stand next to that nurse's computer and confidently advocate for my patient, whatever they need to be advocated for, whether it's meds that they need or just social, like, hey, let's get someone down here to help them with mental health struggles while we also treat them for their asthma attack, whatever it is. And saying, just so you know, I do need to tell them what your biological sex is, but the second words out of my mouth are going to be, but they're transitioning to X, Y, and Z. Please identify them as that and chart it that way. And know in the system that the whole picture, not just they walk in and say, hey, so-and-so, like treat you as a young woman when you walk in and you're like, I'm not, like, that's not who I am, right? And I think just doing that full picture is the best way to go about that, if you agree or disagree.
And making sure you don't be defensive. If they say, oh, well, I would like to be called this, don't get defensive about it and be like, oh, well, I was wrong. Like, it's okay to understand you will get stuff wrong. Don't approach this as a defensive point. Open mind, open arms, like, it's fine. I'm here to advocate for you. Just let me know what you want. I got you. But absolutely following up with the biological. I have to tell a hospital what's going on, but I'm going to let them know exactly what's going on. I advocate for you, my patient. My patients, I want them to feel safe when they are in the back of my box.
Yeah.
BSI, if my scene is not safe, why would I want them back there if they don't feel safe?
Yeah,
I want them to feel safe.
That's cute. I like that. Scene is safe for everybody involved.
Everyone.
Not just the one wearing PPE.
Scene safety for all.
Yeah. Oh, put that on a t-shirt. And make it rainbow.
I'd wear it.
And I feel like even if you don't understand, is it really that hard for you just to be respectful, right? Like that's one thing I really don't get. Like, maybe you don't understand why somebody would want to be called different pronouns, but is it really hurting you to call somebody the pronoun that they're asking for? Like, is it really that hard to say they, them instead?
Or to try.
I just don't get it, or to try. And you're going to make mistakes, and that's fine. And as long as there's understanding on both sides of that was not a malicious mistake, and like, I'll get you next time. We'll be better next time. And I think, just give your best effort with it. And I think that's going to resonate. I think with everybody, with everything, as long as we can tell we're trying. I
mean, Absolutely. The best way that I always explain it is we meet a lot of people with longer names that prefer to go by shorter names. You prefer to go by Chris instead of Christopher. How hard is that? Like, that's the same idea, right? Someone likes to go by Nick instead of Nicholas. It's the same thing. That's a preferred name, right? Like, it doesn't have to always be a preferred name to describe you as the opposite gender. It's something I prefer.
Yeah.
And I can respect that no matter what.
Right.
And going back to what you were saying with understanding, you don't have to understand. I will never understand half of my people in my queer community. I don't need to, though. I liked exactly what you said about a couple moments ago. You talked about they are people. That is it. Period. That's the only point I need to make is they're people.
They're your community.
They are my community. Right? They are people. They have a right to this belief. Let them enjoy just being a part of their life. Understand that I want people in my life. I enjoy my community. Be open-minded and, again, open arms.
It boils down, like we were talking to Wade earlier before we started filming, and he's often the guy that's like, I don't care. But I don't mean that in a negative way. It's just like, who are you hurting? I don't care, right? A lot of people describe their beliefs on lots of different things as I don't care. And they don't necessarily mean it in a negative way, like Wade was talking about.
Keep going. But I had the conversation with him yesterday.
Yeah. He's like, well, I do care, but I don't know. Like, and it's like, I don't care in the sense that do what's going to make you happy. You want to be called XYZ instead of XYZ? Cool. You're not hurting me. How does that change my life to call you Samantha instead of Samuel? Whatever, man. That's awesome. I'm so happy that you found something that makes you happier in your life. We're all just trying to pursue the most happiness that we can find. Why can't we help each other doing that?
Yeah. But I think, me as a straight dude, I kind of hate the term ally because to me it seems so patronizing. But like, I think to be like, if you want to be a good ally, I don't like saying I don't care because that was my mindset for a long time ago, but I do. I just respect your right to live the life you want to live. When I say I don't care, I think when some people say I don't care, I think that's what they mean. Like you do you, whatever that is. But saying I don't care, I think comes off as like, well, I don't support you. When I don't think that's what it's meant. But to me, when I hear somebody be like, well, I don't care if they're gay or whatever, like, but I do care because I want you to feel supported. So I've changed that terminology for myself. Like, I don't say like, I don't care. I say like, I respect you for who you are and I'm going to support that instead of I don't care, which may be splitting hairs, but.
No, I think that's, and I don't mean this in a patronizing way, but I think that's cute. Like, that's nice that you're being deliberate with the words that you're using. And I feel like I don't care, like we're talking about, it comes off as like, I don't care, but having a queer partner comes with a whole different set of struggles than if you have a straight white man partner, right? Like, or a partner that is a person of color. They're going to face different struggles than I maybe would. So just like face value someone being gay or queer, that isn't the end of the line of who they are and the things that they struggled and faced to get there, and people telling you have no space in EMS because you're queer. Like, did you have that as a straight white guy in your EMT school? Probably not. You know, like nobody looked at you with the white man with the mustache saying, you won't fit in here. Like but there's people that look at people in the queer community and say that. And so I don't care sometimes doesn't give the appropriate weight to the situation that maybe allows.
And
and
that goes beyond just sexuality. That's
right.
People's race and all of that, saying, I don't care about this person's color, to me is the same thing of like the whole like, well, I'm just colorblind.
I knew you were going to say, I don't see color.
Right? But it's not true.
Yeah, it's not.
What we need to be saying is, I support you whoever you are, is what we need to say now. I don't care who you are, because I do care about you and you as a person, and I support that person.
Totally. Because I want to say it the other way. I care about you so much that I want to respect what pronouns you want and want to respect and make it comfortable for you. So I kind of go the other way. I totally care. Because it makes you.
Totally.
And I want to support you as a human or as a person.
Right.
So yeah, I kind of tend to say the other thing. Like, I really care.
Yeah.
I mean, I don't care what you do in your bedroom.
Right.
But I care about you as a person. So I want to respect whatever you need to tell me that I need to respect.
Yeah.
That's why you're Mama Kate.
Yeah,
exactly.
It is.
We talk about this all the time.
And I take that. I love being called Mama Kate at the office because I do want my staff to be comfortable. I do want them to feel loved. That is important to me. And so if you've got things that make you different, awesome. I want to know about those things and I want to support you in those things.
And they can often be an asset. Like,
yes.
If you have someone that's a queer person in your class and maybe they don't quite see eye to eye or feel like they learn the best from so-and-so, and now you have another person that can teach them better or get them to be more educated because they see eye to eye or learn better, why is that not an asset?
That
or even on the truck, like
makes it so much better.
If you have a queer partner, whether it's an ALS or BLS call, right? If you have a partner that can get along with the patient better and make them feel more comfortable, as long as licensure allows, right? Because we still have a job to do. Why would you not utilize your female partner to get along with the female patient, or your queer partner to get along with the queer patient, or X, Y, and Z? There's plenty of times where I go on calls and I see the way that we're all interacting together, and I take a step back and go, I might not be the best person to put my 2 cents in. I'll go get the nebulizer so we can just get this tune-up going. Like, there's always something to be done, and there's no shame in being like, I'm not first string for this. That's okay. That does not mean you're a bad provider. Everyone's different, right? Like, and there's been plenty of times where my partners are like, hey, can you take this one or talk to this person? I think that you might be able to connect better. Doesn't matter that I have an ILS level licensure and they're medic. There's different skills that come with just who you are as a provider. We're not all the same for a reason, which is a good thing, right? So,
but as someone who's coming into EMS, that's a skill you learn. It's one of those things like, well, how do you gauge this? At the first part of my EMS career, it was very hard to learn to gauge these situations. But as you start practicing and you start seeing these situations, absolutely, there's times I'm like, I'm going to stick my partner on this one. Why? She would be a lot better at this than I would be.
And that makes you a better partner for doing that.
Yeah, and we're like, well, we're both paramedics. Like, yes, but I can see that this would definitely help my patient. So I'm going to let my partner take over this call, and she ran it beautifully. That makes sense.
It's an old lady, and old ladies love Tim. So Tim, get over here.
Yeah, exactly.
We know there's going to be that connection that we might not have.
Unfortunately, I have had multiple old ladies grab my cheeks because they said I have very bubbly cheeks. And I was like,
that's so funny.
As a preceptor, it was not a fun time.
How do you feel like that? Sorry to take over as the moderator, but how do you feel like that? Like, you get along with your older patients, but do you struggle to like see eye to eye with your big burly firefighters? Like, how does that affect your personal interactions with them at the station? Like, do you feel like they treat you? I don't know, just whatever you have to say.
From Texas, the firefighters I mostly dealt with, yes, I have had times where I have to be as manly as I can be, as awfully weird as that sounds. It's just, unfortunately, I turn into a more business professional. When I walk, I throw my body around. I am a very loosey-goosey person. People can look at me a mile and go, he's very good.
That's what I was saying. Yeah.
When I go into certain settings, I know how to kind of flip it, and I'm like, professional Tim, how are you today?
Yeah.
Excellent. What's going on? How may I assist you? Excellent. Yes, I have had firefighters who look me up and down and go, I don't think you're cut out for this. And I'm like, I'm a better medic than you will be, unfortunately.
Just because I
won't
can get
say
to know
that,
people,
but,
not
like,
because of your beliefs, but because
Absolutely.
I'm not going to cut someone off because of X, Y, and Z.
Absolutely.
Yeah.
Absolutely. Simply judging me by the way I look, I'm like, I am not a brilliant doctor in any shape or form. I'm a smart paramedic, though.
Right.
In the nicest way, I'm good at my job. I love my job. How could someone just look me up and down and do that? Welcome to our world. That's
Right.
one of those things you have to kind of, you're going to see it, whether you're a woman, a man, straight, queer, color, you're going to find those people that just look at you and go, you're not good enough for this.
But just poke a hole straight through you.
Poke a
immediately.
hole straight
Yeah.
through you. But the confidence of understanding your community and who you are as a person, as a provider, knowing every day when I get on a truck or when I go out into my community, I'm there to do the best that I can be as a paramedic to my patient.
Right.
That hole fills up very quickly.
Yeah.
Easier in time where, I got poked really badly today. Some holes take a lot longer to heal because they really got you with a good phrasing where you're like, I now feel like a crap of a person. I don't deserve to be even around these people that I love. No. In time, you kind of learn, I am worth my worth. I have done, like Chris said, I have done the credentialing. I love being out in my community. I love actively providing the best care that I can. I am worth it. And I'm going to fill those holes up really well to the point that I'm whole again. I know that's a weird kind of phrasing, but that's the best way I can describe it is I am confident in knowing that I'm doing the best that I can for my patients in my community.
Sorry, go ahead, Chris.
Have you seen when you kind of prove yourself a little bit, have you seen that change sometimes where people look you up and down, like based off who you are, they're like, you don't belong here, but what are we going to do? We're on 48-hour shift together. And after they like, hey, this guy's a good paramedic. Have you seen that shift that allows you to kind of open up who you really are a little bit more?
Wildly. People will often see and go, oh, you're not just a kid who stepped off the street and is now in an ambulance. I'm like, no, I'm certified to do this. I'm good at this. I love talking to people. I know that's one of those personality aspects that it works really good in medicine. If you know how to communicate, people get mind blown and they're like, wow, your bedside manner is really good. I'm like, no, I'm just a really good communicator. There's a difference. Yes, bedside manner is important, but knowing how to communicate to people is one of the best aspects of, bedside manner. I know how to talk to people. I keep it very chill, ask the questions I need to. I can interact, cut up with someone if I need to, bring some joy into probably one of their worst days of their life. Yeah. They're in an ambulance. They're probably not having their top 15 best day of their life.
Right.
So we see these people who are really low, and my partner sees that and goes, wow, your partner or your patient was not really wanting to talk to you, but you got them to open up. And it's like, yes, I'm good at what I do. And that confidence boost of knowing I can do this. I'm able to do this. And if you're not able to do it, practice makes perfect. I was not good at it when I started. It took time, but I've definitely impressed multiple medics who are like, wow, you actually really do care. I'm like, I absolutely care about my patients. Again, if you are coming into this field and you don't, you probably, I'm not going to say probably, you should not be doing this. Walk away happily with a smile on my face. Walk out of EMS. This is not for you.
Yeah. I feel like I have such the opposite, and this is where our interactions are different. Just because we're both queer doesn't mean we have the same experiences,
Absolutely.
right? But I like when the super masculine men kind of put a wall up with you because they see you as a more flamboyant feminine man. They don't know how to communicate with you. I feel like sometimes when I am in the crew quarters with the guys, they are too comfortable. Like
you're just a bro.
They're like sit in the locker room talk, and I'm like, I'm good. Like, why are we like? I don't like the whole like talking about women. They say like, oh, you like women, so we can talk about how we all feel about women. I'm like, oh dear God, no, thank you. So like I get like kind of roped in with the locker room talk, and just because I like women does not mean I want to talk about not even like vulgar things, just like how sometimes men in the locker room talk, air quotes, can like objectify women in an uncomfortable way. It's like, I don't want to be involved in this just because I like women. Like that's not what I want. It's a weird like overcorrection of like, oh,
hey Sid, you want to come do this 12 lead?
It's like,
those,
no.
yeah. No,
I don't. Now I really don't want to. And it's like,
Even
like
more so like, oh, thank God, no, please.
Yeah, exactly. But then also there's like the counter overcorrection where it's like, I'm going to do the 12 lead because I know how you talk about women in the crew quarters. And this is a 25-year-old woman that does not need, like, I don't know. But nobody should be talking about people like that, especially in healthcare.
For sure,
Like you were saying, it's the worst, most vulnerable day of their life. Let's put some stickers on their chest and take a picture of their heart the most professional way that we can. Come on now. Like, that's gross.
Yeah.
I've seen like memes like that on the internet about like the medic giving the EMT the nudge to go do the 12 lead on the young woman. I'm like, that is disgusting. You guys are gross. Like, we didn't get into healthcare for that. And if you did, I want to blacklist you from every agency in the country, please. Like, can we create a large Google Doc for that? Because that's gross. Like, ew. I don't know. I'm not a big, just because I like women, I hate when people objectify women at work or in personal life. It just makes me really uncomfortable. And maybe it's because before I was more comfortable in who I am, I identified and presented myself as a more feminine woman. So I experienced it. And now that I'm on the other side of it, I never want anyone to make people feel the way that I was made feel, like the whole catcalling and all that kind of stuff. And I just like, I can't change everybody's mind and all that jazz, but we're talking about our patients. We're healthcare professionals. Act like it. Just because I also like women does not mean I want to be a weirdo freak like you. Like, I'm good, you know? And so it's kind of a weird kind of flip where it's like, oh, you're the feminine one. We can't talk about how we like women in front of this guy because he doesn't like women. He doesn't get it. But oh, this person likes women. So let's do the locker room talk around them. It's like, everyone stop. I'm scared.
On the flip side, when it comes to 12 leads, women loved it when I gave them 12
Right,
leads.
I'm sure.
In the nicest way. Felt safe.
Yeah,
and they're
exactly.
like, oh, you're not threatening. I'm like, why would I be? I'm not wanting to be threatening. Ew. Again, I want you to have the best care. I'm taking pictures of your heart. Yes, I'm going to have to, take your shirt off, but like, handle it a professional way. Females have never had an issue with me putting a 12 lead on them.
Yeah.
Approach it professionally as a provider, and they don't want to feel objectified.
And then
no one wants to feel objectified.
Especially when they get old, even if you're a dude, you're like, I need a 12 year. They're like, go for it.
Yes.
Like,
Just
no
rip that blouse
hesitation.
off.
Don't care.
You're like,
go
wow,
for it.
The fluorescent lights are really bright on this ambulance.
And you just look at it like,
Yeah, there's definitely the level where they're just walking around naked.
They
and
don't care.
The level of care is just
yes.
gone. They've given it up.
You're like,
for
oh, do you
sure.
want us to throw a blanket on you before we take the gurney outside? No.
No.
Oh, okay. All right.
Is
Well,
it
just
terrible though that I do enjoy seeing like firefighters who are like kind of fresh coming in, and the old woman just rips her blouse off, and the men are like, oh God, what do we do? And I'm like, it's fine. You just have to understand. She's like that.
she doesn't care.
She doesn't care. It doesn't mean anything to her. It means something to you, but like
It's also-
it does not mean anything.
It's also probably not her
It's a
first.
body.
Patient. I
It's
know.
a body. It's a human
it's
body.
anatomy. I'm like,
Right?
We get into teaching some like middle school classes for CPR,
yes.
and they always are taught. I taught with one of our other paramedics that's an instructor, and one of the young girls came up to me and was like, well, what if it's like a girl? Do you still cut their shirt off? And,
Oh, that question comes up every time. In middle
I
school.
mean, prepubescent teenagers, that's a fair question. Like, your body is something that you're trying to understand, and God, you don't want anyone else seeing it. Like, it's a fair question. And I had a coworker at one of my last agencies that when he had younger siblings ask him that, he's like, I see a body, not a naked person. And I was like, that's a really good way to describe it, right? And anyways, back to that topic, I was like, life over a limb, right? Are we scared about maybe exposing you, or do I want to get you to come back to life? I want to get you to come back to life.
absolutely.
But that's when it comes into being professionals. If you hear people that aren't professionals talk about that, they're weird about it. It's like, what are you? I don't know. I just get really icked out about that. It's gross.
Yeah. Yeah. And you shouldn't be thinking about it. Like, just like at a point, it's almost like they're a mannequin you're doing a scenario on.
Yeah.
And I don't like to go too far that way because they are people and we
Right.
need to treat them as people. But especially like the high acuity calls, like they're almost kind of it's a problem to solve. It's not even a person anymore. And like, yeah,
It's here to work.
I'm going to cut clothes off and I'm going to look real closely for bullet wounds or whatever. I'm not looking at anything else.
Right.
Anatomically, I'm looking for my landmarks so I know what I'm looking at and
Right.
what I expect to see there. And that's from there on, I will put a blanket on. We're all, it's,
Treat for shock.
yeah, you're a Ken doll, right? Like
Right.
you're a Barbie doll, whatever. To me, essentially,
Right.
Rescue Annie.
Right. There you go.
We're coming up on time.
Yeah.
One other question I wanted. Well, we're actually past time. Sabrina's over there pointing at the watch.
Sorry, Sabrina.
No, it's good. It's been this is a good conversation. I was really excited when this is going to happen because it's not a conversation that's had often at all in EMS. And
this is what happens when you get the
necessary.
queers start to talk, okay?
We just go. Anyways, go ahead, Chris.
If you guys could talk to your younger selves coming into EMS or before EMS, thinking about this as a job maybe you wanted to do, and you don't need to get into your stories or your personal lives or anything like that, but just in general, what would you say to yourselves? Would you any insight, any words of encouragement, advice, anything like that you could give to your younger self, or by proxy, younger people watching this that are in your shoes or want to be in your shoes, but aren't sure because of their sexuality? Like what kind of advice could you give to them or anything of that sort?
You want to go first? Up to you.
You got it. Go for it, Tim.
Okay. What would I say to a younger version of myself or another young EMT coming in? I would say understand your goal of why you're becoming an EMT and focus on that. Struggles are going to happen. You will make mistakes, but you need to focus on your goal and understand that it gets better with time. Know that you are going out there to be the best provider for your patients. Everything comes easier. You're going to have so many hiccups, so many road spikes. You will get through it. You will be able to persevere, and you're making your community a better place because of those roadblocks.
Yeah, I think that's awesome. Don't let anybody tell you that you can't do your job because of who you are.
Absolutely.
Quote unquote, right? Like I as much as I would have loved to see someone that looked like me in my education system, just because I didn't mean that I was like packing it up and heading home, right? Like that's not the truth to it all. Know if you're just about to start EMT school, know your book, know your stuff, so that when even someone tries to poke a hole, if they were to try to poke a hole in you because of your identity, whatever that might be, you know your book top to bottom, and you know how to get your assessment done, and you know how to talk to people. Who cares like about that kind of thing? Build up your community, and if you continue to progress and you maybe do meet someone that is of a mentor level to you that you feel like is in your community, don't be afraid to talk to them and ask them, hey, how do you, like, have you dealt with being on a call and so was rude to you because of the way that they perceived you? So many topics are too taboo that people don't want to talk about them. Let's talk about them. That's how we're going to bridge the gap, right? Like, let's find the ways that we are alike or different and learn about each other. If I were to have seen someone in my education journey that looked like me, I would have loved to ask them those questions. As I met people and when I continued to progress and meet those people, it was great to bridge the gap. It's all about bridging the gap. The more we can learn about each other, the better. The better providers we can be, the better partners we can be, better humans we can be. Like all the human-to-human interactions that I've learned about at work, I've brought to my outside life. It doesn't matter that I know what the goal BG is supposed to be. I know how to treat people for who they are because they're humans. Treat people like humans. That's all we're all trying to be, right?
Mm-hmm.
We're all certified at the same level. We all understand what we're looking for. We're trying to be the best providers we can be.
Yeah.
That's the goal.
Be good enough that none of that other stuff matters.
Right, exactly.
Like a little bit of, right? Like be above that you're be unquestionable in your skills and your knowledge in this stuff. And I think you're probably gonna have those firefighters turn around of like, oh, dude, they rock. Like I was wrong to judge them.
Be yourself.
Yeah.
I mean, Tim's talked about like kind of his own personality gives them an advantage in talking to some of those older ladies and those other people. Be true to yourself. Show us who you are and show us how you do it and do it the best you can.
And if you feel like you aren't getting a job or a position because of something like that, maybe it's not the place for you. And that's okay. Not every agency is the place that you need to be, or every coworker needs to be your best friend. It's okay.
Showing you the red flags.
Totally.
Nice and early.
Totally.
Do you guys have any good resources being part of the queer community that I just don't know that maybe you could share with somebody that's not sure? Like, is there any groups or anything that, there's like a meeting space or something like that for queer people in EMS or queer people in general that you have found helpful, or that you can kind of shout out here to, maybe somebody is not even sure who they are,
Right.
those kind of things that we have a platform. Is there something, some way we can use it that you guys would have something Kate and I just wouldn't know about maybe?
Right.
I don't have a whole lot of resources, but I also kind of live under a rock. And since I just moved up here from Texas, I have multiple queer friends up here.
I mean, just in general, right? Like, is there like national stuff or Facebook groups or anything like that, right?
I don't have anything that's EMS specific, but these weird interactions that you could have with coworkers is not an EMS specific thing, right? Yeah. You can feel that kind of weird tension because you're a queer person in a professional setting, no matter what your professional setting is. I'm a big fan of here in the Boise area going to local Boise Pride events, and the queer community spills out a lot into our local music scene around here. And I go to a lot of those events, and even though I'm riding in an ambulance and you're, I don't know, maybe working a corporate job, we can still see eye to eye on some similar struggles. It doesn't need to be EMS professionals, and I haven't found anything that's EMS specific, but finding your local queer community, wherever you may be, whether it's in the Boise area or beyond, you'll find people that have similar professional lives more than maybe you realize. Just talk to people. Everyone's got a story. It's fun to hear them. Yeah.
Cool. Any closing thoughts, Kate? Anybody?
No, I just appreciate you guys. I appreciate you being you and being the best at your jobs and being here.
And I wanted to say thank you to both of you for taking this time. It truly means a lot. And when we talked about it, the other day, you were like, hey, I want to ask you how to do this, but is it weird that I'm asking you because I know that you're queer? And I think that I know you and I know that it's coming from a good space. And I think that it was helpful to me as a person, but I hope anybody that that has watched this and maybe learned something or felt seen, it's really awesome. And not to, go too crazy, but, pat yourselves on the back. It's truly amazing. And I thank both of you. And I thank Tim for also sitting here with me.
Agree.
It's truly amazing. And I can't say that enough. So thanks, guys.
Thanks.
I've had some rough experiences in Texas since I've joined this company, been with you guys. I love knowing that this place is a very safe space. Totally. I'm happy to talk about myself. That's not common for me. I do not talk about myself in public. It's just the way it is. And some people are like, oh, that's sad. I'm like, welcome to our world. I don't know what to tell you, but I'm very grateful to have you guys, especially get to be a part of this team, and know that this is a very safe space for us.
Yeah.
Yeah. Like, That's okay too. Thank you for coming on. It's really easy for me as a straight white dude to be like, let's talk about these things because like,
I don't know anything.
Well, and at the end of the day, right? Like no one's going to be upset. I'm the straight white dude. Right?
Yeah,
like,
right.
You guys are the ones putting yourselves out there, not me. So I really appreciate you guys coming on here and talking to everybody. Hopefully everybody watching, listening, whatever, take something out of it, whether you're queer or straight or whatever, or, let's all just learn from each other and become better providers and better partners for each other and all that. So, maybe in the future we'll try to do something like this again. I think it's something that we can definitely talk more. I think we could have kept going for a long time.
Oh, for sure.
But we can definitely,
sorry, Sabrina.
we can, there's other avenues and things to talk about in the future. So definitely we'll have to do it again.
Sweet.
Maybe, I don't know, Sid's moving off to Oregon. So.
No,
We're going to get her back. I'm convinced.
Hook her like
I'll
a fish, bring her back.
I'll try my best, guys.
That's what Idaho's good at. Fishing.
Absolutely. I know.
Cut hook or whatever you said.
Cut and shoot.
There we go.
Cut and shoot, Texas.
Cool. Yeah. On that, thanks guys. Thanks Mama Kate for being here too.
Thanks.
Hit subscribe, like all that stuff. If you have questions, please leave them in comments. I'm sure that these are not the only queer people who are going to watch and listen to this. And maybe the comment section can be a good resource for people that might have questions. And of course, come from the right place, like we talked about earlier. But yeah, we'll see you guys on the next one. Thanks.
Of course. Thank you for being here. Have a good one.
Got a finger guns because no Wade.